This program focuses on two skills which are beneficial in counseling clients: reflecting content, which includes the skills of paraphrasing and summarization, and giving information. Reflecting content lets the client know that you understand his perspective, how he sees a particular situation, or how he sees himself. If he perceives that you understand him, trust will be established, and it will be easier for him to expand on his story. Reflecting content also helps to provide direction for the conversation from a client-centered stance. The first component of reflecting content is paraphrasing a single statement which the client says, or several statements, and reflecting these back to him. In this way, he is encouraged to continue the discussion. For example, Rick has had diabetes for a couple of years. He has been diagnosed with rheumatoid arthritis since his last biannual visit to the diabetic clinic. On a recent visit to the clinic, he talks to the nurse about his arthritis.
I don't know how to deal with this illness and how it ties me down. I don't see how it can be anywhere normal again. I feel so hopeless.
Hopeless?
Yes, it seems as if I've been trying so hard, doing my exercises, eating well, getting enough rest, and yet it seems there's no improvement.
Here the nurse merely repeats the last word which the client says, the essential message in his statement. It encourages the client to expand on his feeling of hopelessness. Of course, the nurse might have used a question here. For example, what makes you feel hopeless? However, sometimes a minimal response can be just as effective. In the scene you just saw, the main idea is given at the end of the client's statement. However, no matter where it occurs, reflecting content can maintain focus in the conversation, as can be seen in the next scene.
My big problem is how my wife reacts to my illness. The children are all grown now. One lives in Toronto and has a law practice. The other just lives up the street. They visit a lot. They're great kids.
You were saying your wife's reaction has caused you some concern.
I got off track there. It's hard to talk about it because it seems so silly. I might as well get it off my chest. When I was first diagnosed, my wife was understanding about the pain and why we couldn't go out so much anymore. But lately she seems...
Note in this exchange that the client is hesitant about discussing his situation. The nurse's paraphrase invites him to have the courage to explore his concerns. Obviously, in order for the paraphrase to be accurate, the nurse must listen carefully to what the client is saying. Not every paraphrase will be accurate, and then clarification can occur so that the nurse does understand what the client is saying. As well, reflecting the message in language similar to the client is more near experience for him. Note that in paraphrasing, the nurse is attending to the cognitive component of the client's remarks. Paraphrasing can be a challenge if the client is talkative, as then the essence of what he is saying needs to be pulled from many statements. Yet, such a client may need help in focusing on the main concerns. At times when clients hear the paraphrase, they develop insight into their problems, perhaps for the first time. Sometimes a client will talk in a hostile manner to a nurse. Paraphrasing can be particularly helpful in this situation, in preventing the nurse from becoming defensive or being drawn into the argument.
Before I was diagnosed with fibromyalgia, I had such a full life. I used to work out at the gym all the time.